Welcome to the Business Leadership Podcast. I'm your host, Edwin Frondozo. I am happy to share this episode, which is a special collaboration with Up Next Global and the Brampton Venture Zone, celebrating BVZ's 5 years of bold founders. I was honored to sit down as the interviewer and learn directly from this community of builders, innovators, and leaders. So let's get to it. Today I'm joined by Shreyansh Anand, the founder of Wave Medical. They launched Wave during the pandemic to improve healthcare delivery, and now their platform supports hundreds of thousands of patients every month. Their journey is about resilience, innovation, and building for impact. Shrey, I just want to start. What was it like starting a med tech company during the pandemic years?
It was interesting because it's a huge transitionary period when it came to healthcare. Healthcare is famous for being extremely resilient to change. The doctors, for good reason, don't want to change workflows too much. There's a lot of pressure to make sure that things don't break, which goes against the general innovation ethos of making sure that nothing changes as much as possible, because we don't want to rock the boat too much. The pandemic was an interesting time where, because everything was under so much strain and so much stress, there were a lot of clinics who had a shifted mindset of, okay, we need to be able to help these patients as much as possible, and we can take a little bit more risk when trying to figure out how to help them. And so in an odd way, starting during a pandemic allowed this shift to happen in the doctors' mentalities and the clinical staff's mentality to try new technologies like artificial intelligence or better automation tools to help support them as they go through that really odd time of being under a lot of stress and strain while also being the forefront of protecting the patients.
I mean, that was a very interesting time. I was just actually thinking even Zoom calls was a thing. Like, that wasn't a thing before
Zoom calls
COVID.
And things. Telemedicine or getting phone calls for healthcare was really odd. And back then, very few doctors were taking that practice, but now it's just common day.
Yeah, and they were able to adopt. I guess that was a very good shift in terms of pushing innovation agendas, I guess, on
it just made it more broad to the idea of, okay, what does healthcare mean? And how do we make sure that people are getting the care they deserve? And by being able to open up the eyes and, okay, how do we think about this on a more holistic point of view? It allowed for companies like us to try to figure out how do we fit in to help them with this transition, this change.
Yeah, that's amazing. That's great. So, we're during the pandemic. How did the Brampton Venture Zone really help you gain, the early credibility and that traction at the time?
Yeah, I think a lot back to the mentors themselves that the Brampton Venture Zone connected us with, and how we were able to work with them and gain their trust and try to understand how do we build a system in a way where it can work in healthcare especially. Healthcare is one of those places where everything is based on trust. It's all about trust capital. The more trust you have, the more people are willing to give you a shot and try out your solutions. And if you don't have a very high amount of trust, they're not going to test you no matter how good the system may look. And so with the mentors that we received through BVZ and through the programs, we were able to work with them and figure out how we should build a system to ensure that we keep that high amounts of trust. And in fact, we got, at the time, our largest clinic, which is around 60 doctors, to use our systems because they heard about us through our mentors who vouched for us and saw us grow as a team, as a company. And now they're using us for over a year now, that clinic.
Oh, that's amazing. And it's really important to, from the sounds of it and BVZ, being part of not only the ecosystem, having these trusted mentors who I'm assuming, Shrey, also have that medical experience or solution experience as well. Can you share a bit in terms of, specifically those mentors and how they really guided you, even where things that you may not have known?
Yeah, we had 3 different mentors. One who was focused more on building software companies, one who had a combination of building technology companies while being in the healthcare space, more on the life science side, and we had one who is a practicing physician. And so the combination of 3 helped us understand more exactly where we can fit in, how do we fit into this ecosystem, how do we gain that trust within the doctors and within the healthcare place, but also just how to build a company. How do we raise money, how do we get investors, how do we take care of hiring? All of these practices, we got a lot of support and help from our mentors, and we use some of those lessons still on the more tactical side. Okay, how do we deal with clinics? How do we get people interested in what we're working on? If we're going to a conference, how do we network successfully to make sure that it's a successful conference for us?
Yeah, that's amazing. Shreya, how do you and I guess your team now at Wave envision how the impact, how Wave is impacting patient outcomes, and really, to your point, and BVZ, like inspiring the future entrepreneurs in this space?
Our system is used by hundreds of clinics across Canada now, and we're very fortunate to do that. And we're very fortunate that a lot of our clinics we work very closely with them. We act like a part of their team, and so they tell us all these different stories they've had, which really keeps us going. One of my favorite stories is that we have a clinic in Vancouver. It's a clinic of family doctors, and they received a urgent document at 6 p.m. on Friday. It was a mammogram that came up as abnormal. And normally what would have happened is that document would have been sitting there, left there until Monday morning. That's when the staff would have read it. But our system read that document, reviewed it, and at 6 p.m. it realized it's abnormal and needs to be looked at right away, sent an alert to the doctor saying, hey, this is urgent, take a look at it now. And by Monday morning, that patient was in the office getting their next appointment. And it's stories like this which really keep us going. That doctor was so happy when he told us, like, Shrey, you really helped this person in their journey and getting their treatment faster. And it's stories like that which keeps us going.
Yeah, and it really empowers I only assume, and thank you for sharing that story, the impact that these doctors could provide in the services, because I guess in the past, before a system like Wave, like that would have been days, if not weeks.
We've had so many clinics we work with who there's like a little magic in their eyes or a little glint when they see our systems in action. Like, Trey, this is huge. Yeah, there's just magic in their eyes when they see the systems in action, actually processing medical information, actually reaching out to the patients automatically. It's really cool to see.
Yeah, and they get to really just focus on what they do best and not this how to follow up and picture these things. I mean, I have 2 young children, so I just think about this stuff all the time too now. So it's pretty interesting.
Unfortunately, the way that medicine has evolved, especially over the last 20 years, is that we're throwing more and more data and more information at the healthcare system, which is not necessarily a bad thing, right? We're getting remote patient monitoring, things like the Apple Watch are starting to put in health outcomes. There's more doctors who are able to provide more detailed outcomes and detailed explanations because they have better tools. But what's that leading to is that there's just more information flowing everywhere, and the doctor's role and the staff are just completely overwhelmed. And so what we're trying to do is we're trying to remove as much of the excessive noise that is going on and is causing all these problems. And that's really what doctors and staff are loving, is that information is flowing faster and there's less bottlenecks happening.
And not to mention the self-diagnoses that everyone has the tools to like get all their own data, and they're making their own analysis. We're in an interesting time, and I think to your point, I mean, all this data it's amazing. It's amazing space, but I can't even imagine, being the doctor.
No, it's like the staff's role over the last 20 years has become more and more almost robotic in a sense, because before they were able to actually help the patients much more actively, be more of the problem solving, what makes us human. But because of all this excessive information, that role has decreased to the point where it's just trying to keep up with all this information. And so problem solving has gone less and less, and that's what we're trying to bring back to the medical role.
We might have spoken about this, but I just explicitly wanted to ask, like, how did BVZ influence your engagement with healthcare stakeholders?
Yeah, absolutely. So it was when we were very early on. We only had a couple clinics who were talking to us and even testing it. And what we realized early on is we really need to build that trust capital, make sure that people can trust us, because it's healthcare. You don't want to mess up in healthcare, and you can't afford to mess up in healthcare. And so BVZ helped us not only learn how to gain our own credibility, but also gave us some credibility that, hey, we're building something here in the heart of Brampton, and this could be something which could help out a lot of doctors and clinics. And so it was through them that we got our next set of clinics who came in. We learned how to talk to clinics better and how to sell better and so forth.
Yeah, so aside of the trust, and I know you mentioned trust a number of times, what other unique resources that BVZ, and maybe the first thing that comes to mind that really gave you the momentum?
Yeah, I mean, apart from helping us get that first set of customers, which I know BVZ is really proud of, being that embodying that hustle that's really famous in this city. But going even beyond that, just how to raise money, how to build a team, because a lot of what we have to do is build teams and inspire people to join us in this journey. And that's where a lot of our help came from.
So Shrey, I guess now, we're sitting here 5 years of the BVZ, looking back at the journey, what was the single most valuable lesson you gained being part of the community?
Ooh, that's a tough one. I think it's just really important to put yourself out there. I know when we first started our company, I mean, we started out of university. We didn't know what we were doing, and we didn't know how to show that we knew what we were doing, because we knew how technology works really well. We knew how to process medical information really well, but we didn't know how to show that to people. And so working with BVZ, we learned a lot about how to show confidence, how to show how the systems works, and be honest with clinics, and be honest with medical staff, to really proclaim, like, this is how it works, this is how we can help you, and to really put ourselves out there.
I guess the last question I wanted to do is really in one sentence. How would you describe BVZ's role in your entrepreneurial journey?
I think BVZ was critical when it came to really embodying that hustle that they really tried to instill in us, and really put ourselves out there, which allowed us to get that momentum to grow to where we are right now.
That's amazing. Well, congratulations on all your success, and thank you for joining us today.
Yeah, thank you so much.
That's a wrap, folks. This episode is part of the BVZ 5 Years Bold. It was produced in collaboration with Up Next Global. I'm grateful for the opportunity to learn from the founders and the BVZ community that continues to shape the Brampton innovation ecosystem. Until next time, have yourself a 100x life.